When we are going for the causes of infertility, there will be the common causes is tubal block. Why the tubes will be blocked? Usually main reason is infection. Maybe pelvic inflammatory disease, maybe urinary tract infection. The tubes may be sensitive. Whenever the wife and husband are having coitus, sometimes the infection will go through the semen and the tubes gets infected. The tube usually nonsense, like very healthy tubes, usually they won't get any problem of infection, but the very sensitive tubes and little unhealthy tubes, actually they will get problem immediately. So what will happen? Sometimes both the tubes are blocked. Both the tubes, if they blocked, and we will try to resolve the block, but if we usually most of the times it doesn't happen. That is the reason we just tell them to go for IVF procedure. So fertilization we will do outside, and then we will transfer the embryo into the uterine cavity. So, and suppose if one tube is blocked, what you have to do? One tube is blocked, anyhow you have diagnosed that one tube is blocked, even in the laparoscopy or even in the hysterosalpingogram, HSD, tubal patency test. Then what you will do for the second tube? Okay, marital life already 5 years over or 6 years over, and you came to know that only one tube is open. Why she is not conceiving? If one tube is open, usually they will conceive. Many people, they will conceive very naturally with one tube, only one tube, and they don't even undergo any of the tubal patency test. They don't even know whether there is any problem in the other tube or not. But sometimes what will happen, if we come to know that one tube, right tube is patent, left tube is blocked, what happened to right tube? Why it is not giving conception properly? So whenever the infection comes and it affects both the tubes, one tube is got blocked and the second tube, that is the right tube, actually what I am saying, right tube is it is proper, but the inside structures, that microcilia and microflagella, I will show you the picture. See, this right tube is okay, left tube is blocked. Okay, we forget this thing. And what will happen to the right tube? Inside the structure, cilia, flagella, actually they will not get properly cured, even with the antibiotic course. So what will happen? The inside, the fertilization will not occur. The egg will not come inside. The spermatozoa will not come up to this level. Then the fertilization will be affected. So sometimes in the other tube where it is getting blocked, see, the block will be maybe in this fimbrial level or ampullary level or isthmus level or somewhere in the cornwall. So if it is in the cornwall end, if the block is in the cornwall end, it is okay. Suppose the block is in the isthmal end or ampullary end or this end, hydrosalpinx or pyosalpinx in the fimbrial end, then you have to block the tube, you have to cauterize the tube, and then the other ectopic pregnancy may not occur in this tube. And when this tube is not working, what you have to do? You have to block this tube in this cornwall end, you have to block this tube in this cornwall end, and we are not utilizing tubes anymore for the fertilization, and we are creating the embryo by the process of IVF or ICSI, and we are keeping the embryo here. And the embryo should not go in opposite direction, retrograde direction, and it should not enter the tube again. If it enters the tube again, tubal pregnancy may occur. So that is the reason in cases of hydrosalpinx or pyosalpinx, actually what will happen? We will cauterize the tubes at the cornwall end, otherwise we have to, sometimes it will get affected. The embryo implantation, after IVF procedure, the tubal fluid will pass and will wash out the embryo from the endometrial cavity. That is the reason in cases of hydrosalpinx or pyosalpinx or hematosalpinx, that is the blood inside the tube. Pyo means pus inside the tube. Hydro means water inside the tube. That will wash out the actual embryo, what we are implanting in the endometrial cavity. So that is the reason, even though one tube is good, one tube is not good, the other tube also will get affected. We will not notice at all. It looks very normal. Laparoscopically everything normal, but you will not get conception. So finally what is your goal? Your goal is to have your child in your hands. So you have to come for a good doctor, come to a good doctor for conclusion. What procedure you have to undergo, in what way you are going to get your baby, everything. You have to talk to your doctor very properly, very clearly, and you take one decision, and that decision should be followed by you couple. Then you will get pregnancy.